all of you. As Senior said, today we are going to learn about subcutaneous infusion. So most of you are familiar with subcutaneous injections, but in not subcutaneous infusion. But in palliative care, most of the time we prefer subcutaneous infusion. So today we have an eminent faculty, Mr. Sajan, who is a senior palliative care nurse, and it's around 10 years of experience in palliative care. Now he is in charge of infection control in our inpatient department. Sajan, welcome and over to you.
Thank you, sister. Once again, good afternoon to all. Actually, introduce about myself, not repeating, but my name is Sajan. In Parliament, I am working as a nurse since 8 years. Actually, this topic mainly, especially for the nurses, the topic subcutaneous infusion. As we all know, we are having so many routes are there for the administration of medication, parenteral or a non-parenteral route. Can anybody tell about some of the example for the parental route and the non-parental route? Some of the parental route, can anybody tell?
Please unmute yourself and talk, or you can put your answer in the chat box. Please share. So only one answer we have received at total parental nutrition. Any other route?
Okay, actually getting so many answers. Mainly in our practice, mainly majority of in parental route means everybody practicing intravenous or intramuscular route for giving injection. In non-parental means non-parental, some example. Oral, transdermal. Okay, again, some answers also getting as a non-parental route, oral, topical, rectal. Okay. As we discussed, we are having so many routes. In parental route, this topic is including subcutaneous infusion. First of all, before directly going to the topic, I'm just introducing the layers of the skin. Mainly, I am just dividing the layers into three: dermis layer, subcutaneous layer, and the muscle layer. So the second most layer, subcutaneous layer, about this layer only we are going to discuss. Subcutaneous infusion. For the subcutaneous infusion, having another term also. Anybody know? Another term for subcutaneous infusion. Okay, next slide. Another term for the subcutaneous infusion is hypodermoclysis. Actually, this term, what it means, hypodermoclysis. Just split the word into three. Then we can get the meaning from the term itself. Just split into hypo, first part, dermo, second part, clysis, third part. Hypo means, as the meaning per word only, hypo means below, below the level of. Dermo means dermis layer. Below the dermis layer, which layer? Subcutaneous layer. So clysis means administration. So hypodermoclysis we can define as administration of small volume of injection type. That means bolus type injection or large volume of infusion to the subcutaneous space or subcutaneous tissue is the hypodermoclysis or the subcutaneous infusion. Next slide. Then, mainly in palliative care, already as we discussed, so many routes are there for the administration of medication. But if any parenteral route of medication, if we needed to give for a patient in palliative care setting, means mainly in my experience also, I can suggest the subcutaneous route only. Why? Because first one, if the patient having severe nausea and vomiting, severely the patient is suffering with vomiting and nausea also, at any cost, if the patient is seeing food item means also at that time, just patient feeling severe nausea or vomiting, severe vomiting. In some cases, due to the severe vomiting, at last some fecal matter also may will present according to the disease condition vomiters. In such situations, we cannot promote the oral intake by the patient or oral medicines for the symptomatic management. In such situations, that horrible situation, we cannot depend the oral type of medicines for the symptomatic management. We can give the injection type of medication or for the maintenance or for the fluid balance for the patient also. Any drip or like an infusion, anything we need to give means also as a subcu route, we can give the injections and the infusions. Then, if the patient having severe swallowing difficulty or dysphagia, painful swallowing, if the patient is having such situation also, patient cannot take oral type of tablet or syrup form of medicine for the symptom management. Such situation also, we can give the injection type of medicine by subcutaneously. Then, any oral ulcer or any lesions in esophageal area or mouth or throat area, in such situation also, due to the lesion and the ulceration, the patient is unable to take the oral type of medicines. Such situation also, we can give injection type of medicines by subcutaneously. Then intestinal obstruction due to the primary reason or the prognosis basis also, mainly cancerous condition related to the gastrointestinal system. At any time, we can expect the intestinal obstruction. Due to the intestinal obstruction, the patient will unable to take the medicines, unable to take any food item. In such situation also, we can use the subcutaneous type of medicines and infusions for the maintenance and for the symptomatic management. Then unconscious patient. Don't think about the unconscious patient. Mainly we seeing in the ICU setting, mainly in palliative care setting, due to the prognosis basis or due to the progression of disease, at any time we can expect the patient in the end of life stage. In end of life stage also, patient may will becoming on the stage of unconscious level. Then that time also we need to control, we need to treat the symptom. We need to maintain the quality of the care for the patient. Such situation also, the injection form and infusion form we can give by subcutaneously. Then, suppose you are seeing one patient with a severe pain. That means while you are seeing an OP, that patient is suffering with a 10/10 pain or 9 by, as a score basis, I am telling 9/10 or 10/10 severe pain. patient is crying due to that much pain. Such situation also, if the tab form of medicines, pain medicines, or syrup form of medicines is it appropriate for the patient that time? It's not appropriate. In such situation, injection form of medicine only needed at that time for controlling the symptom as fast as possible. So such situation also, injection form of medicine only we can depend to give the symptomatic management for the patient. By subcutaneously, we can do that. Then already we discussed in non-parental route, if suppose can't give by orally means, we can choose rectal route. So many of you from your group already given the answer as like rectal route is another route if it not possible by orally. In some situations, practicing in my career also, if the patient is having spurious diarrhea or loose stool or any signs or any history of hemorrhoid, in another way, if the patient is not willing to take by orally due to the shyness or due to the privacy issue, patient is not willing to take by rectal route. Such situation also we can only the injection form of medicine. By subcutaneously we can give. Excellent. Then some contraindications also there. In some situations, we can't give the subcutaneous injection or infusion. First one, if the patient is having cellulitis or any rashes or skin tear area is having means, we cannot give the subcutaneous injection and infusion on that area due to the skin problem. Then already the area whichever we going to select for giving the subcutaneous injection, already the area is having existing tissue edema means also we can't give because already the edema is there. That means poor fluid absorption. Already the collection of fluid is there. Again, we giving the injection or infusion means it will not help. It will not help the patient to get the relief. So we can't give. Then if the patient is having the evidence of dehydration, in the case of dehydration, we telling mainly mild to moderate dehydration means we can give the infusions as like drip. For the rehydration, we can give by subcutaneously. But in the case of moderate to severe case of dehydration history is there means, or in our assessment, we are assessing as evidence of moderate to severe dehydration means we can't choose the subcutaneous route for the rehydration. Only the mild dehydration we can give subcutaneous fluid for the rehydration purpose. Next slide. Then yeah. Next. Next, we're going to discuss about the common sites we can give the subcutaneous injection, or we can choose the subcutaneous sites on these areas. Anybody can tell some of the sites? Can you suggest some of the subcutaneous sites in your practice?
Anybody have any experience in that subcutaneous infusion? Sajan, I think they are not. Maybe in other institutions they are not following that subcutaneous infusion. They are new to this. I think if they are able to answer, they can answer it. Just can think about and answer it. So what he is telling about the subcutaneous infusions. So in your idea, what are the areas we can choose for subcutaneous infusion?
Two answers already got: abdomen, umbilical site, outer thigh, upper thigh. Okay, some of the answers already got. We can move to the sides. Next slide. First one, upper chest area or intercostal plane. Upper chest means if we need to be very careful if we giving the injection in upper chest, mainly in female patient, means don't involve in the breast tissues because it will cause the damage for the breast tissues. So be very careful while we choosing upper chest for the subcutaneous injection in the female patient. Then upper arm or outer aspect or lateral aspect of upper arm. Both hands we can give lateral aspect. How we will measure in upper arm? We can tell the measurement as in upper arm if we giving on the lateral aspect means about 7 centimeter or 4.5 inches from the level of the shoulder and from the level of the around only I am telling 4.5 inches or the 7 centimeter below from the level of our shoulder and above the level of our elbow. We can give the injection on the upper arm or lateral aspect in upper arm. Then abdomen means 2 inches around the umbilicus. We can give the subcutaneous injection in the abdomen. Abdomen mainly practicing while some of the patient they self taking insulin means so many patients choosing the abdomen on umbilical area. Already some of the patients practicing. Then lower arm means lateral aspect of thigh or outer thigh region in lower arm. We can give the subcutaneous injection. Then scapular region. Both scapular region also we can give the subcutaneous injection. Diagrammatic representation I will show in next slide. Then last one, upper area of buttocks or just behind the hip bone. Next slide. This one is the diagrammatic representation. First one, upper chest area or intercostal plane. Then the upper arm, both outer aspect or lateral aspect of both upper arm, around the umbilicus, lateral aspect of both thigh, then both the scapular region, then both upper aspect of buttocks. These are all the main sites we can give the subcutaneous injection. But mainly in our practice, we choosing both lateral aspect of upper and both lower arm. Upper and lower arm, both lateral aspect we practicing. Why? Because in home care setting also we can practice, we can educate the caregiver for practicing the subcutaneous injection or for maintaining the subcutaneous infusions in the home care setting also. So when we choosing the lateral aspect of both upper arm and lower arm means the caregiver is little bit confident for giving the injection on these areas. If it not possible due to any contraindication means other sites we can choose. These are all the common sites we can give, but mainly we choosing the upper and lower lateral aspect. Next slide. Then some volume and rate I am telling. Suppose I already in second slide I told bolus type of medicines we can give. That means one bolus injection if we planning to give by subcutaneously means we need to maintain the rate as 1 ml per minute. don't exceed the rate from 1 ml. If it happen means it will cause the pain for the patient on that area. So we need to maintain the rate as 1 ml per minute. As a infusion we are giving means we need to maintain as within the 20 maximum 20 ml per minute. 20 drops per minute, 20 drops per minute. So we can tell us 1 ml per minute or 20 drops per minute. Don't exceed the rate, it will cause the pain. Then, if we giving the continuous infusion for the patient means in one side we can give 1.5 liter or 3 pint of fluid or 1500 ml of fluid we can give in one side within 24 hours or within 1 day maximum. If we choosing again second side means again we can give 1.5 liter. Total in two sides we can give 3 liter or 6 pint or 3000 ml of fluid we can give by subcutaneously within 24 hours or within 1 day. We can choose another site also, maximum 2 sites only possible. These are all the volume and rate I am telling. There is no need to give this much 3 liter or 3000 ml by subcutaneously. Maximum rate and volume I am telling. In our palliative care setting also, for the maintenance of the quality of life, if we need to give any fluid for the maintenance, we can give by subcutaneously. Next slide. Then, before going to the preparation, I'm just telling some of the example for the medications we can give. I already told some bolus type of injection and some infusions also we can give by subcutaneously. When we discussing about the bolus type of injection, some of the examples I am telling, some of the medications. First one, in our practice also, in our experience also I am telling, commonly we giving injection morphine. We can give the subcutaneously. Then injection haloperidol, injection midazolam, then injection metoclopramide or injection perinon. Metoclopramide, another name, perinon. Then injection hyoscine butyl bromide or buscopan. Injection fentanyl. These are all the common medications we can give by subcutaneously. Studies are going on daily in between proving us some more medications we can give by subcutaneously. But mainly in our practice, I am telling these are all the common medicines in our practice also we giving by subcutaneously. Some other medications, is it possible? Can anybody tell? Is it possible any antibiotics or any other type of medicines or any infusion as like drip? Anything we can give by subcutaneously? Is it possible? Can anybody tell? Is it possible any antibiotics we can give by subcutaneously? Okay. No antibiotic medications we can give by subcutaneously.
Yeah.
Already I told some of the examples of the medications we can give by subcutaneously. None other medications we can give by subcutaneously. Means no antibiotics or no hypertonic solutions we cannot give by subcutaneously. In infusion, as like drip infusions, any type of we can give means 0.45% to 0.9% of solution. That means normal saline. Normal saline, NS only we can give by subcutaneously. No other infusions we can give by subcutaneously. It's not possible because it will cause the tissue damage or tissue irritation, poor absorption also. So we cannot give. Then for the subcutaneous injection or for giving subcutaneous infusion, as like every procedure, we need some preparation also. First one, we need to explain the procedure to the patient. Why? In many cases, in my practice also, I am telling, while we first seeing the patient, already the patient is on curative side of treatment, already it's completed or on continuing stage itself also. They are all well known about the intravenous route for giving the injection and for giving the infusions. But subcutaneous route is a new one for the caregiver and the patient. So while before starting the injection or infusion by subcutaneously, we need to explain about the procedure to the patient. Then select the infusion site also. For that, next slide. After selecting the site, already I told about the sites, which are all the sites we can give the injection or infusion. So we need to, after the selecting the site, then assemble the fluid and the tubing. Already I told the recommended fluid, is it possible or not, we need to check. Then we need to assemble the fluid and the tubing. Then already we selected the site. So the selected site, we need to clean. As like we need to use the swab with any antiseptic solution. So the swab we can use for cleaning the area. Selected site, we need to clean as like a circular motion from the center to the outward. Inner to outward circular motion, we need to clean the area by using the soaked swab. After the cleaning, 2 to 3 seconds, we need to leave for drying. During this period or after the cleaning and after drying, don't touch again on the selected point for the subcutaneous injection with our bare hand or with fingers. Then already the selected, cleaned, prepared area, we need to insert the needle. Which needle we can use for the subcutaneous injection? Needle means what, or any set we can use? Can anybody tell any size of the needle or any type of set we can use for giving the subcutaneous injection? Okay. If we inserting the needle for giving the bolus type of injection means mainly we using 26.5 size of needle we can use for giving the bolus type of injection on the subcutaneous area. Then suppose we need to maintain on needle on that place for giving the continuous infusion means we can use scab pain set or SV set, but butterfly cannula, blue color butterfly cannula. In our practice and in our setting mainly practicing blue color scab pain set or SV set, butterfly cannula we can use for inserting as a needle on that area. While we pricking, we need to maintain the pricking angle should be 45 to 60 degree of angle. 45 to 60 degree of angle we need to maintain while pricking on the selected area. Then after pricking for secure, then we need to secure the needle or secure the set, SV set on that area and the tubing with adequate adhesive dressing. We can fix on that area. Then after fixing this needle or this SV set, we need to connect the assembled fluid and tubing on the set. Then after connecting, we need to adjust the drip rate also. Rate, I already told, if the bolus type of injection we giving means we need to maintain as 1 ml per minute. Any infusion as like drip we are giving means we need to maintain as 20 drops per minute. Within the 20 drops per minute, we need to adjust the rate also. Next slide. Then diagrammatic representation I am giving the angle for the subcutaneous 45 to 60 degree of angle. Next slide. Then after the already we did everything, we connected the infusion or we given the bolus injection. If suppose we after connecting the infusion means after the procedure, we need to do some of the thing. First one, already I told within 24 hours in one site, we can give maximum 1.5 liter. But after connecting within 2 hours, don't cross 1 liter in one site. Already I told within 24 hours, we can give 1500 or 1.5 liter. But don't cross 1 liter within 2 hours. Then after fixing, after securing the set or needle on that area means after that we need to, as like IV cannulation only, we need to maintain the date and the time sticker also we need to maintain. We need to mention the date and the time on secured subcutaneous site. Then document the infusion or any fluid we are connected means we need to document the infusion or the medication name on the chart. Then after starting the infusion or after giving the injection on the subcutaneous area means check after 1 hour. First thing I am telling, after 1 hour, we need to check the area about is the site is correct or not. Have any signs of edema or any leakage or discoloration or any fluid collection on the site. Is anything it's have or not? We need to check. Mild edema is actually it's normal only because subcutaneous injection mainly happening, the fluid will collect for some times on that area. After the collection, the fluid, then it's absorbing by slowly. So mild edema is normal only. While explaining about the procedure to the patient, we need to explain this also. Mild edema is normal only. But the edema is not subsiding due to the over edema, any leakage or any painful situation is patient is facing on that area. Then already I mentioned as like discoloration, any other signs we are seeing or not, we need to assess after 1 hour. Then if any necessary, this type of any signs we seeing means we need to change the site. We need to select another site for continuing the infusion or giving the injection. Next. Then for the subcutaneous infusion or injection, some of the advantages are there. First one, low cost. Means already I told for giving infusion, mainly we can use the butterfly cannula or SV set. So comparatively the IV cannula, the SV set or butterfly cannula is low cost only. Very much low cost only. So it's mainly if this procedure is a continuing in home care setting means also again the purchasing these utility items by the patient caregiver means also they can afford comparatively with the IV cannulation. Then more comfortable than the IV administration. While we administering time also more comfortable for the patient, the subcutaneous administration. Then this IV administration is little bit risky only, but subcutaneous infusion or subcutaneous injection will not have that much risk because this subcutaneous infusion or injection having no direct involvement with the circulatory system. Already I told it will collect this in the space, then slowly absorbing. It will not directly involving into the circulatory system. So as like IV administration, there is no chance for the causage of pulmonary edema or any fluid overload as like happening in IV cannulation. It will not cause in the subcutaneous administration. Then simple insertion than IV subcutaneous. It's easier reinsertion also because you can in your practice you can just imagine while we doing the IV cannulation time how many painful procedure or steps we continuing for succeeding the IV cannulation finally. That much maybe the IV patency is not there means that much tightly we need to tie on that area or any assistance if we need means they need to tightly hold the area. These are all the procedure may will happen pain for the patient. Again, if after pricking the IV cannulation is not succeeded means also again the reinsertion, again this much painful procedure we need to continue for up to the succeeding of the IV cannulation. But in subcutaneous insertion, there is no need for these much painful procedures. Just select the area, hold the area without any assistance. One staff or one caregiver can prick and fix the needle or set on that area. So it's very easier and simple insertion than IV. Then already I told home care setting. If the home care we are continuing means IV cannulation, mainly the family member or nearby any health practitioner is there available means they can change or they can maintain, they can give the IV type of medications and the infusions. But there is having no assistance or no help means they can't maintain the IV cannula in home care setting. Such situation, home care setting, we can educate, we can promote them to maintain and do the subcutaneous infusion and the subcutaneous injection in the home care setting also. In home care setting, there is no supervision for the in every time of subcutaneous infusion, there is no chance for getting the supervision from any staff on the caregiver or in any home care staff also. While doing the home care time, if the staff maybe majority of our team also having only one nurse in one team, there is no supervision or help will get from any supervisors or any assistants. Such situation also helpful for the staff also. Less supervision needed for the subcu insertion. Then I already told it will not directly involve into the circulatory system. So it will not cause any thrombophlebitis, mainly happening in the IV infusions and the IV cannulation time. Then there is no chance for mainly happening in IV cannulation, septicemia or systemic infection maybe will happen because it directly involving in the circulatory system. That type of complications also will not happen in the subcutaneous injection or subcutaneous infusion. There is no chance for the clot formation also. In IV cannulation, continuously the clot formation is happening means we can't continue the IV cannula for giving the injection or infusion. But subcutaneous route means there is no involvement in the circulatory system, so no clot will form. At any time, we can give and stop the injection by the subcutaneously. Just imagine if we put on IV cannula today morning, we given on bolus type of injection in today morning or any infusion today morning. May we needed to give another injection or infusion maybe today night at midnight or tomorrow morning. At this much time, this IV cannula we not at all using for giving any medication. Maybe at that time, this IV cannula due to the clot formation, we cannot continue for giving injection. But in subcutaneous injection, there is no these type of complications will not happen. At any time we can give, or within 2 days, maybe, example I am telling, within 2 days, no bolus injection or no infusions we giving in subcutaneous route. That set or that needle we keeping and we placing on that area very securely. If there is a no irritation, there is a no complications if the patient is telling on that area, we can continue, we can continue that set or that area for giving the injection. That is the main advantages. Next slide. As like advantages, some of the rare disadvantages also. Already I told, in volume and rate, I already told, mainly we can give 1 ml per minute or 20 drops per minute. That's the usual rate only. More rate or more volume of fluid, if we needed to give in such situation, means we cannot give the injection or infusion by subcutaneously. This one is the first disadvantages. Then some already I told, some of the medications only we can give by subcutaneously. For the electrolyte, if suppose for the electrolyte imbalance, some example I am telling, 3% NS we need to give. For the sodium correction, we need to give, means we cannot give by subcutaneously. We can give only by intravenously. As like nutrition, some of the additives, any other medications, antibiotics, already I told, in such medications, if we needed to give for the patient, means we cannot give by subcutaneously. This one is the second disadvantages. Then mild edema on the infusion site is common only. I already told, while we starting the procedure, we need to explain to the patient and the caregiver as mild edema is normal only. It will subside after some time. If it not subside, means only we need to think about for changing the area or it's discontinuing. So mild edema on the area is the common. This one is also, if the patient and the caregiver having the thinking about the edema on the site, means it's a disadvantage. Next. Then some of the side effects and the complications also I am telling. This first one, localized edema. Already I told, mild edema is normal only. Suppose the edema is not subsiding, means we can solve the issue by spontaneously or with the mild massage. We can, mild massage only, we can solve the problem. Second one, inflammation or cellulitis. Already I told, while we after choosing the area, after the selected site cleaning, again we don't touch on that point with our fingers and hand. If this type of technique is not practicing, that means poor insertion technique supposed to be did, means that will cause the cellulitis or the inflammation. So in some cases, along with that, asepsis also will happen. So poor asepsis, it's happening mainly. It's very rare only. We need to be careful on that while doing the procedure. Then pain or discomfort patient is seeing, facing on that area, means it's also very rare. We need to maintain the rate. If the rate is not maintaining 1 ml per minute or 20 drops or within 20 drops per minute, it will cause the pain for the patient. Rare only. We already after before setting, we need to look the advices about the infusion, how much rate or how much volume we need to give. Everything before the procedure already we checked, and then only we going to start. So already we set the rate as within 1 ml or within 20 drops. There is no chance. But if the patient is telling the pain on that area, means we need to recheck. If the rate is maybe it's faster than 1 ml or faster than 20 drops, we need to check and we can resolve. Suppose more than 1 ml bolus type of medication, if we needed to give by subcutaneously, means that much patience we need to give. We need to maintain for giving the injection. But that much slow, that much time will take 1 ml per minute. So 3 ml we need to give means 3 minutes we can use for giving the injection on that area. So that rate we need to maintain, otherwise patient will feel the pain and discomfort. Then puncturing of blood vessel during the insertion. During the insertion, the angle while pricking on that area, 45 to 60 degree of angle we maintaining means there is no chance for pricking on the blood vessels. But some cases, after fixing the set or needle on that area, while doing their own patient own activity, in between, some cases may will hit that area. That set fix the area, maybe hitting on any corner of the wall or corner of the door side. Such situations will puncture the small capillaries and may cause the puncturing of the blood vessel. In such situation, while examining time or while assessment time, if we see means also, we need to change the site. We can't continue the site for giving injection, resite the subcutaneous device. Then hematoma around the insertion site. It's also very rare only. Suppose if the patient already having the history of a low platelet level and or the patient is already receiving any anticoagulant therapy, already the patient is receiving means also, there may will get the chance for the hematoma formation around the insertion site. So we need to be careful on that only. It's very rare only. Then infusion device occlusion. After connecting the infusions on the subcutaneous site, after fixing, very rare only it will cause the infusion device occlusion. So not easily will go as like the rate and volume. In such situation also, we need to check the tubing. Connected tubing, we need to check. It may will cause the kingling of the external tubings only. We need to check and we need to clear. After that clearance, we can continue the infusion by subcutaneously. Next slide. Then one thing also I need to add, after the fixing the subcutaneous set, as we said, or any needle on the subcutaneous area, after fixing, some as a nurse, some of the responsibilities are there to recheck that area. After the pricking, after 1 hour, we need to check. Again, we need to check as a routine basis. Every 4th hourly, we need to check the area again and again. It's having the signs already I explained. There is having any tenderness or any hardness on the site or not. Then any hematoma, already we discussed hematoma on that area, or any insertion site is having any leakage, or patient is telling any pain on that area, feeling of pain on that area, or that edema is not at all resolving, it's not subsiding, more edema on that area. These much of signs, if the patient is telling or not on assessment, if you're seeing these any signs means we need to change the site. So every 4th hourly, as a nurse, we have the responsibility to check, recheck the sites again and again. So in this topic, about the procedure for the subcutaneous infusion or subcutaneous pricking on that area, fixing the set, infusion, about this one video also there. We will play along with this topic. Then in between, before showing the video, anybody have any doubt in from in this topic?
Thank you, Sajan, for the presentation. Anybody have any doubts on this? Please ask him, or you can put in the chat box. So we have a video on subcutaneous infusion. We'll show on that, and then in the meantime, if you have any doubts on this topic, please put it in the chat box.
I'm requesting all to turn on their videos. Please turn on their videos for 5 minutes, at least for 5 minutes. If you are not turning on your video, I have to assume that you are not present at class. So please.
Bindu, Diana, Gurupreet, Jagru, who else? Nancy.
Nancy has already requested that she is traveling, so she can turn on her video.
Okay, Priya, Purnima, Raj Kamal. What happened? Sangeeta, are you there? Shindu, Usha.
Yes, ma'am.
Yeah, please turn on your video and see this video. This is very, very important. Okay, we can show it.
Subcutaneous infusion of fluids or hypodermoclysis.
So that is my experience. Sajan, anything you want to add?
At one time, two medicines, if we need, means we can choose two sides. But as per the situation only, if the patient is not willing for the multiple pricking, means we can give by in one side.
Yeah, we can wait at least 15 minutes. After giving one injections, we can wait another 15 minutes. Then the next medicines which we can give the same route. So otherwise, you can choose two sides.
The time taking for the absorption and the getting action by the medicine is also some delay for the subcutaneous route comparatively with the IV route. For example, suppose injection morphine, I'm telling for example, injection morphine 1.5 mg if we giving by intravenously means is in morphine trial cases I am telling after 10 minutes we can repeat the intravenous next dose as a trial. But subcutaneous route means we need to wait 5 more minutes. Means total in between 15 minutes only we can repeat next dose. That much time will take for every medicines comparatively with the IV for the subcutaneous.
Okay. Can we wind up?
If there are no questions, we can wind up the session.
Okay. Thank you, Sajan. Thank you for giving an excellent presentation today. Thank you, participants, for clarifying your doubts and for your participation. Once again, thank you all. We will meet you next day. Thank you once again, Sajan, for the wonderful presentation. Thank you.
Thank you.
Thank you, Mr. Sajan, for a wonderful presentation and wonderful narration of that situation. Thank you all for joining us today. We are expecting active participation like this in the upcoming sessions too. We'll see you on the next session. I have shared the feedback link with you in your WhatsApp group and in the chat box also. Please kindly go through it and fill it up. We'll see you on the next session. Bye-bye.